My name is Kendra Nielsen-Miles. I am the Executive Director and founder of EDS Wellness, and we're here to do a Q&A video recording with Dr. Linda Bluestein. She's on our medical advisory board, and we're trying out this new video conferencing recording strategy, I guess, technique, resource to hear more about her new practice and to introduce her and to share this Q&A that we're going to share with her announcement of her new practice. So Dr. Linda Bluestein, thank you for being here. Do you want to introduce yourself?
Sure, I would love to. As Kendra said, I'm Dr. Linda Bluestein, and I'm really excited to share this announcement of the opening of Wisconsin Integrative Pain Specialists. I did my medical school at UCLA in Los Angeles, California, and did my anesthesiology residency at the Mayo Clinic and practiced as an anesthesiologist for a little over 20 years. I have always been fascinated with integrative pain management and got involved in the world of connective tissue disorders like Ehlers-Danlos syndromes, and wrote a continuing medical education article about how frequently missed Ehlers-Danlos syndromes are in patients that present to the clinic with pain that is kind of difficult to understand in a lot of other ways, and this is something that's so often missed. So I ended up getting involved with the education aspects of this, and as I got more and more involved, I realized that this is a population of patients that so desperately needs help and so desperately needs doctors that know that they really are having a lot of challenges, and they need doctors that are going to be supportive of them, that will help spread this information within the medical community, and also help them approach this in an integrative fashion. So I'm really excited to announce the opening of my clinic.
So you officially open?
The official first date of appointments is December 11th.
That's great. Well, we're super excited. I mean, the community obviously needs a lot of help in many, many ways. And I have always said that one of the best things that I could do as a community or as a person that's part of the community or as a founder of an organization is say to you all who are willing to help us, how can we help you? There's nothing more that I love than to be able to help you all help us. And we need a lot of help, and it's a lot of help for many ways. It's not just diagnosis, but it's management of care, and pain is a big part of it. So if you're talking about integrative, what do you mean by integrative?
So for me, the approach to pain management is really a very multifaceted approach. I believe that it is very important to fully consider all of the factors that are in a person's life. So whether it be their nutrition, their sleep, where they are psychologically, their social support system, their spirituality even. I believe that it's important to integrate all of that into their care. And in addition, integrative to me, well, it officially is actually integrating both like Eastern and Western medicine. So to me, it's the best of both worlds. You're using, all my medical training is traditional. I went to UCLA medical school and then Mayo Clinic, very traditional medical training. But then I also have a lot of training in the more things like acupuncture and the nutrition aspects and some of the other things that, mindfulness and using meditation and, a lot of the mind-body therapies. And I believe that it's so important, especially with something like chronic pain. Pain absolutely robs you of your life. And if it can go so drastically wrong so quickly and can steal you of everything that you hold dear to you, your relationships, your job, your family, your ability to eat, sleep, everything. So it takes a fully multidimensional approach in order to help a person get their life back. And that's what I really hope to do for people.
Well, we're really appreciative of that. I think also what is most exciting for me as a person with EDS and plenty other chronic pain conditions all in one is that that's exactly what is hard about treating us, is that when you have EDS, it's not just EDS causes chronic pain. I have pelvic congestion syndrome that causes chronic pain. I have all these other pathologies that are real pathologies that come comorbidly with EDS that also cause pain, complex regional pain syndrome, headaches, inflammation in my shoulder joints, which was called brachial plexitis at the time. I mean, there's just all these different pain, hemorrhoids. I mean, like there's all these things that we have that are associated with EDS that there's, I think what's hard for somebody that lives it is that there's a different pain or cause of it every day. And you might have 5 different things that cause pain that day. But, and my husband's like yelling in the background.
Well, I can tell you, my husband said to me once, "You sure do have a lot of issues." And so it's easy for people to think you have all these issues. How could you have all these issues?
How does somebody really, do you really have all those issues? I mean, like we want to make it up. Seriously, it's really fun, you know?
Right.
I think what I think is so important that you touched on is that not only do we have to handle it from an integrative approach, but that somebody that is handling pain with us, you have to understand all the different causes of pain. It's not just chronic pain is one condition. It's all these different things that cause chronic pain, and there are all these different types of chronic pain. And we might have 5, 6, maybe 10 at one time, maybe 1 if we're just lucky on a given day. But, you know, there's growing pains, there's musculoskeletal pain, there's the inflammatory pain, you know, that's more associated with different conditions that are associated with EDS. I mean, I think that is probably one of the hardest things to deal with as a person that lives with EDS, but also to then explain to one of the providers. I mean, it's just, where does the list end, you know, of the different causes? And I think a lot of people that treat pain don't understand that there really are all these different types of pain. And maybe if they do understand it, we really can get them all in one person. You know, they really are, they can happen. So
it's unfortunate because there are a lot of physicians, they're busy. They unfortunately, our healthcare system is so incredibly broken, and patients are suffering and providers are suffering as well. It's bad for everybody. And so what ends up happening is there's not enough time in a visit for a person to really, for the provider, for the healthcare professionals to really think about, well, how could all these things be related? And unfortunately, sometimes what ends up happening is, as the patient is describing one thing and then another thing and then a third thing, the person starts to think, you know, and it's terrible, but they end up getting kind of written off. And I think that I'm really focusing on not just taking care of patients myself, but also on education. And I am going to do everything that I possibly can to try to help other people in the medical community. As part of introducing my practice, I'm sending out a letter to all of the local primary care physicians, all of the orthopedic surgeons, neurosurgeons, neurology, PM&R, all of these people. And I'm telling them, if you have a question or a concern about a patient, call me. Maybe I can save them coming to me. Maybe I can just talk to you on the phone and give you some information about not just even EDS, but chronic pain. Right. There's a saying that is pain begets pain. And what happens is, once you have one pain problem, it's very easy to get another pain problem because the nervous system becomes primed. And so the next time that you have a pain problem, it becomes even worse. And there are 3 different types of pain. There's nociceptive pain, neuropathic pain, and centrally mediated pain. And people can unfortunately have all 3. And people that have Ehlers-Danlos syndromes can have all 3 types of pain, as can people with other conditions. But Ehlers-Danlos syndromes in particular, people can have all 3 of those sources of pain. So it can be so challenging, but that's why it really is important to look at family dynamics and what else is going on in that person's life and what are the stressors that they're having to deal with in order to give them the very best chance of stealing their own brain back. I mean, that's really what I'm hoping to do for people through the use of medications and physical therapy and, a number of different approaches, but help them to be in a better place.
Well, I think that was one of the things. I went to that conference I told you about earlier last week, which I was